My name is Phyllis, and I will be going over with you today your CPR and AED review. Based on current American Heart Association and CPR AED guidelines. Join us as we walk through essential CPR and AED skills with practice questions designed to test and sharpen your knowledge. Get ready to boost your confidence and ability to save lives. Visit www.floridatraining.com to download our free CPR and AED study guide and follow along with today's review. All right. Welcome, everyone. Welcome, welcome, welcome. Welcome, welcome, welcome. Welcome, welcome. All right. We're going to go ahead and get started. In emergencies, every second counts. Knowing how to perform CPR and use an AED can be the difference between life and death. Whether you're a healthcare professional or a bystander, staying up to date with CPR guidelines ensures you're ready to act when someone needs you most. Hello, 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 everyone. Good afternoon. All right. Learning life-saving skills like CPR and AED use doesn't have to be intimidating. It could be engaging and enjoyable too. Together, we'll turn critical knowledge into confidence. So grab your free study guide, join the live chat, and let's learn and have fun while we prepare to save lives. All right, you guys. Hello, hello. Hey, Christy. All right, I was waiting a few more seconds for some more to join. So I'm going to go ahead and get started today, guys. First question, what should you do first if you are alone and find an unconscious adult victim with no obvious pulse? Is it A, use the AED immediately, B, call 911, C, deliver 1 minute of CPR, or is it D, deliver 2 minutes of CPR? All right, let's get those answers in the chat. Let's get the answers in the chat. A, B, C, or D. All right, I see some answers starting to come in. And I am going to reveal the answer in 3, 2, 1. If you chose B, you are correct. Call 911 first, then start CPR. If someone suffers cardiac arrest, how long should you take before starting CPR? Is it A, 20 seconds, B, 10 seconds, C, 1 minute, D, 30 seconds? If you're just not joining us, hello, good evening. Let's get those answers. I see your answer, Chrissy. All right, and I'm going to reveal the answer in 3, 2, 1. If you chose B, you are correct. 10 seconds. 10 seconds is how long? Question 3. While walking in the park, you see an unconscious adult. The adult is not breathing and doesn't have a pulse. What's the best thing you should do? Is it A, perform CPR with chest compressions and rescue breathing? Is it B, provide rescue breathing only? C, perform chest compressions only? D, call 911 and wait for the EMS to arrive? Or is it E, either A or C? All right, let's get those answers in the chat. Let's see what we have. Okay. Let's get them rolling, and I am going to reveal the answer. If you chose E, you are correct, either A or C. You can perform compressions only, CPR, or provide 30 compressions followed by 2 rescue breaths. In other words, you do not have to provide mouth-to-mouth breath. Compression only CPR also helps to save lives. Question 4. You try to give an unresponsive adult a rescue breath, and the chest does not appear to rise when you give the first breath. What would you do next? Is it A, perform abdominal thrusts, B, do chest compressions only, C, stop CPR and wait for the EMS, D, repeat the head tilt and chin lift maneuver and attempt the breath again? Okay, I see some answers rolling in. I see some answers rolling in. Let's see what we have. Let's see. All right, and I'm going to reveal the answer. If you chose D, you are correct. Give yourself a thumbs up. Repeat the head tilt and chin lift maneuver and attempt the breath again. Question number 5. After offering resuscitation in the event of cardiac arrest and your patient starts breathing, what's the best recovery position to put them in to maintain a clear airway? Is it A, in a still position? Is it B, in a lift lateral position? C, in a lateral position, head dependent on something and no pressure on the chest? Or is it D, in a right position, head dependent on something, no pressure on the chest? What do we have? Okay, I see some D's. D's. Got some B's coming in, C's. Okay, let's see what we got. If you chose C, you are correct. In a stable true lateral position, head dependent on something, for example, the forearms, and no pressure on the chest. Way to go, guys. Way to go. Question number 6. You are walking along the sidewalk and see an unconscious child. The child is in cardiac arrest. What is the first thing you should do if you did not witness the collapse? Is it A, perform 2 minutes of CPR, B, leave the child and call 911, C, perform chest compressions, D, provide rescue breathing? All right, let's get those answers in. Let's see what we have. I see some C's. A's. Okay. Let's see what the correct answer is. If you chose A, you are correct. Thumbs up. Perform 2 minutes of CPR first and then leave to call 911. If you have a cell phone, put the phone on speaker mode and can call immediately. However, do not delay CPR in an unwitnessed arrest in a child victim. All right, you guys are doing good. All right, question number 7. While performing CPR on a child, interruptions to chest compression should be limited to A, less than 10 seconds, B, less than 15 seconds, C, less than 20 seconds, or D, 1 minute. All right, let's see what the answers is. If you chose A, less than 10 seconds, you are correct. While you are performing CPR on a child, another rescuer appears on the scene. What do you do next? Is it A, transport the child immediately, B, wait until you feel exhausted, then ask the second rescuer to replace you? Is it C, ask the second rescuer to help with CPR to minimize fatigue? Or is it D, ask the second rescuer to give rescue breaths at a ratio of 30-2? All right, let's get those answers in. Let's see what we got. Okay, I see some C's, and the answer is, if you chose C, you are correct. Ask the second rescuer to help with the CPR, minimize fatigue. Next question. What is the latest recommendation for CPR compressions depth in an adult patient? Is it A, 1 to 2 inches, B, 2 inches, C, 2 to 2.4 inches, or is it D, 2 to 2.6 inches? Let's see what we have. All right, I am going to reveal the answer. If you chose C, you are correct, 2 to 2.4 inches. All right, next question. According to the American Heart Association guidelines, what is the recommended chest compressions rate during the cardiac arrest management? Is it A, 100 to 120 compressions per minute? Is it B, 90 to 100 compressions per minute? Is it C, less than 80 compressions per minute? Or is it D, less than 60 seconds? 60 compressions per minute. All right, let's see what we have. If you chose A, you are correct. 100 to 120 compressions per minute. Way to go, guys. Next question. Chest compressions on an infant are delivered with the what? A, entire hand, B, fingers, C, the heel of the palm, or D, the knuckles. Let's see what we got. Let's see what we got. And the answer is, if you chose B, you are correct. Fingers are 2 thumbs. All right, let's move right along. All right, question number 12. How many breaths should be given during a 2 rescue CPR on an adult with an advanced airway in place? Is it A, 1 breath every 10 seconds, B, 2 breaths every 30 seconds, C, 1 breath every 6 seconds, or is it D, 1 breath every 5 to 6 seconds? All right, let's see what we have. Let's see what we have. All right, revealing the answer in 3, 2, 1. If you chose C, you are correct. Give yourself a thumbs up. 1 breath every 6 seconds is the correct standard based on American Heart Association guidelines. All right, guys, you guys are doing great. You guys are doing wonderful today. Question 13. What is the appropriate duration when giving rescue breaths? Is it A, rescue breaths should last 1 second, B, rescue breaths should last 2 seconds, C, rescue breaths should last 3 seconds, or is it D, rescue breaths should last 4 seconds? Let's get those answers in and see what we got. Come on, bring them on in. All right, let's go ahead and reveal the answer. If you chose A, way to go. Rescue breath should last 1 second. Thumbs up, you guys. Way to go. All right, question 14. What are the correct steps when operating an AED? Is it A, open the AED case, remove the AED pads, apply AED pads to the patient's chest, and then turn on the AED? Or is it B, turn on the AED and then follow the voice guided prompts? C, apply the AED pads to the patient's chest, open the AED case, remove the AED pads, and then turn on the AED? Or is it D, apply the AED pads to the patient's chest, turn on the AED, open the AED case, and then remove the AED pads? Let's see what we have. All right, revealing the answer. I see those answers coming in. You guys ready? Okay. I see some A's, B's, and C's. If you chose B, you are correct. Turn on the AED and then follow the voice guided prompts. Way to go, guys, if you chose B. Way to go. Question 15. Which of the following is not a shockable rhythm? Is it A, asystole, B, ventricular fibrillation, C, pulseless ventricular tachycardia, or is it D, all of the above? Let's see what we got. Bring them on in. Bring the answers in. Which of the following is not a shockable rhythm? All right, let's see. If you chose A, you are correct. A systole flatline. A systole is not shockable because it represents a complete cardiac standstill with no electrical activity or coordinated contractions of the heart muscles. Shocking a patient in a systole would be ineffective because there's nothing to reset. All right, guys, you guys are doing good, good, good. Way to go, guys. Question 16. What should you do after attaching the AED pads to the victim's chest? A, give abdominal thrust. B, allow the device to analyze the victim's heart rhythm. C, check if the victim has a pulse. D, turn on the AED. Let's see what we have. Okay. Okay. B's, D, A. All right. Let's see what the answer is. All right. If you chose B, you are correct. Allow the device to analyze the victim's heart rhythm. Thumbs up, you guys. Way to go. 17. Why is it necessary for the rescuer to experience recoil between each compression? Is it A, to prevent injury to the patient's organ? B, to give rest to the rescuer? C, to allow blood delivery to the brain? D, to allow the heart to refill with blood? Let's see, what do we have? All right, I see some C's coming in. I see C's. See a D. All right, let's see what the answer is. If you chose D, you are correct. To allow the heart to refill with blood. Way to go, guys, if you chose D. 18. What is the correct compression depth for an infant CPR? Is it A, 2 inches, B, 3 inches, C, 1/3 of the infant's chest diameter, D, a half of the infant's chest diameter. All right, I see some A's, D's. What do we have? All right, let's see what the answer is, ladies and gentlemen. 1/3, if you chose C, 1/3 of the infant's chest are 1.5 inches. Way to go, guys. All right, question 19. While you are trying to relieve choking on an infant, the infant loses consciousness. What should you do? A, perform the Heimlich maneuver. B, perform CPR. C, do continuous back blows. D, transport the infant to the nearest hospital. Let's see what we have. I see some A's, D. Give you a few more seconds to get some answers in. Give you a few more seconds to get some answers in. All right. If you chose B, perform CPR, you are correct. If a choking victim of any age becomes unconscious, start CPR. All right. Question 20. What's the first thing you should check when entering the emergency situation? Is it A, the number of victims, B, the seriousness of injuries, C, intimate dangers in the environment, D, the location of a first aid kit? Let's see what we have. Okay, I see some C's coming in, A's. All right. Let's see what we have. Okay, let's see what the answer is. If you chose C, you are correct. Intimidate dangers in the environment. Way to go, you guys. Way to go. All right, you guys. Thank you for refreshing your CPR and AED skills with Florida Training Academy. Please don't forget to download your free CPR and AED study guide at www.floridatraining.com. We also have CPR, BLS, ACLS, and PALS training videos on youtube.com/Florida Training. Is there anything you guys would like us to go over? Please put it in the chat. Please put it in the chat so we could try to prepare you guys for whatever test that you do have coming up. Great job, Lifesavers. Please like, share, and subscribe to any of the following on www.floridatraining.com. And you can also get your free CPR study guide there. Okay, more CPR. Okay, no problem. We got you, Miss Kelly. More CPR to come. All right, you guys. You guys have a wonderful rest of your evening. Please feel free to reach out to us on the website as well, or you can email Nurse Eunice at admin.floridatraining.com. Thank you, guys. Have a good one.